Good morning. So on this morning's commute, I want to share with you a patient story I worked with yesterday. I've worked with her actually a handful of times. I think we're on visit number 3 or 4. And she came to me with chronic headache, jaw pain after a car accident back in about 8 months ago. And she's received chiropractic, some myofascial work, and was looking into myofunctional, and then my myofunctional colleague said, hey, let's get you over, let's look at cranium, some more mechanical pieces before we get into myofunctional. So it was wonderful to have her over and assess her. So important as we're looking at our patients is, where did impact occur? That makes all the difference in the world as far as how the body absorbed the trauma into the face, where pressures went in, so for example, she was at a stoplight and she was turned to talk to her children. So she was in a right rotation and she got rear-ended hard. Airbags went off. So she's in right rotation. The airbags went off, bam, all through the left side. And she recalled, she said, hey, I felt my jaw jam into my upper teeth. So as she presented, again, we can see subtle things. I could see the changes through the left side of her face. There were very subtle asymmetries, especially in her eye. So when we think about how the impact went through the bone, through the joints, through the tissues, and as we know, back to forces and these very basic principles of physics, energy is not created or destroyed, it is just transferred. So as we go, here is kinetic energy that is moving, right? Kinetic energy coming through, bam. If she fractured, the energy would dissipate into something else, I guess, right? But so kinetic energy becomes stored as potential energy, compressive forces through the periostomy of the bone, through the tissues, through the periostomy of the zygoma, all the way up into the brain tissue. So what we're able to feel with our hands, again, as we problem solve and put stories together, we can see, with a trained eye can see, which I can see, okay, I see compressive forces, or there's something going on the left side. Okay, pair it with her story, that makes all the sense in the world. The impact came through the left side. Then we layer our hands on, and what do we feel? So for her, as we dove deeper into the story, there were some other traumas to the frontal nasal region, old falls when she was little. So as we started to work with our hands, we could feel so much compression through the frontal nasal region. And the exciting part about that is, again, with a trained hand, not only can we identify, hey, right specifically here, or this particular angle is where forces came in and there's compression, but our hands can restore the mechanics. We can decompress tissues, we can decompress sutures. So areas where bones come together. And for her, and this is where I wanted to do a bigger talk in my clinic, which I will, where I have the skeleton and the skull where you can see, but where bones come together, so much compression forces. So a lot of our work yesterday was continued decompression of the frontal nasal region. We actually started to work intranasal to help open up those nasal passages, because as we unpack her story, then that led into, I'm a mouth breather, right? Which we know mouth breathing is not great for many, many reasons. All the great work that's being done in the airway world. So our goal, how do we open up these airway pathways for her? How do we decompress areas of compression? And as we get into headaches, right, muscular tension, not so much for her, but more so just this continued compressive tension that she had through the bones, where the bones met, where each plate of the cranium met, and then strains on the dura and the tissues. So, and it feels great for her too. Like as I'm getting in there and decompressing, she's like, wow, that feels so good. So after her, she's been used to having so much compression through the side. We literally are opening up to just take some tension off her system, right? So much compression, things don't work well when there's compression, and allows for improved vascularity, improved fluid dynamics, the cerebrospinal fluid, improved interstitial dynamics, pressure in the eye, and that's what we see change most right now for her, is how that eye is changing. We've been documenting pictures. So it's just always exciting to share these stories, these case studies, because every single person is unique in their history of trauma, their history of injury, both short-term, what brought them in, and then also as we unpack the longer-term history of trauma and for what we feel in the body, and then what we need to do to help restore the system so that the body just works with more ease. thank you for joining us. Please share this work with your colleagues. We are getting ready to launch some exciting programs here personally in the clinic, and then throughout my practice in general, as we look forward to teaching more people. We need to teach more people this work, kind of the big theoretical application of the big picture of things, and then also training people to use their hands. There's a big push in our physical therapy worlds to not use our hands to help people. So it is more important than ever for us to share this work, because people are searching, people are seeking, and they're not getting the service that they need from some of our traditional colleagues. Again, there's many who do, and that's wonderful, but there still are perhaps, right, 10 to 20% who need this more advanced, precise work, given their unique history of injuries and traumas. Jennifer Shepard, Shepherd